Hi, welcome to MG Life Hacks, the channel for folks with myasthenia gravis. If you're not sure of what myasthenia gravis is and you just kind of stumbled across this, myasthenia gravis is a neuromuscular disease that causes extreme weakness. There are a few different types. I have generalized, which means it is all over, and everybody experiences myasthenia gravis a little bit differently. It's all weakness, but in terms of the areas that we have the most weakness, it's going to be a little bit different for everybody that I've seen anyway. I'm a patient. I am not a doctor. Let's get that out there. I'm in accounting, but I have a couple different hacks that I've found having this diagnosis. It will be, it's just over 3 years now, but I want to share them, which is why I created this channel. I do have a couple other videos for anybody else with myasthenia gravis to try and help the general community, because it is a rare-ish kind of illness, and trying to find ways to do daily tasks can be very difficult. You have to think outside the box, and sometimes it's coming up with creative solutions or talking to each other. That being said, today's topic that I wanted to bring some tips for is gum and tooth care, because for me anyway, that's been kind of difficult. Prednisone can only do so much in terms of helping inflammation. However, I am going to continue weaning off of that, and God willing, I will get off of that. But one of the things that I found that helped is water flossers. For anybody that has to have a water flosser, if you're over a certain age, your gums tend to create bigger gaps between your teeth, particularly by the bottom of your teeth, and it causes all kinds of problems and inconveniences, and who needs that? But water flossers are extraordinarily heavy, for me anyway. Probably for most people with myasthenia gravis. And when you fill that thing up with water, it is very difficult to maneuver around, but you got to get the job done. And flossing the regular way is also considerably difficult, because you're wrapping it and then you're doing this, and you got to take a break, because it's hard, because you're holding your neck up, you're holding your shoulders up, you're probably standing, you're probably leaning over, you're probably holding your arms up. That's a lot for someone with generalized myasthenia gravis. So talked to my dentist. He recommended one of these, and I didn't know they existed, so this is awesome to me. There are countertop units that you can get, so you have to fill the tank with water, and that's it. And you can rest that sucker on the counter. From that unit, there's a cord that extends out with a little tiny, flosser unit that sprays the water. It's fantastic because it's so much lighter and it's easier to lift and move around than having to do it with this heavy unit on top of the job itself. Love that thing. That helped a lot. The other thing that has helped on the days where I am not able to do that, because life happens and flare-ups happen and you physically can't do that. You could barely get to the bathroom to use the bathroom, wash your hands, and get back to the room. That being said, on those terrible, terrible flare-up days, I'm of the mind that something is better than nothing. It's also just generally helpful, but there are these picks that you can use. It's like, no, I don't make commissions, but it's GUM is the brand, and you just take one of these little suckers and then you stick it in the gaps right there, just up, and then you flip it down for the bottom part, boop, 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 boop. And I can do that in bed because I have this on my nightstand most of the time, just for those flare days that just hit out of nowhere, but I haven't brushed my teeth and I have to do something, and I hate not doing anything at all, especially when it comes to my gums. So I have, some supplies in my nightstand so that I can do some kind of brushing. It's not the best job in the world, but it's something, just to try and help keep my gums and my teeth as healthy as I can. The other things that I have found doing, this was particularly helpful after I got home from the hospital because I was exceptionally weak. I noticed that my legs were taking the most strength all over. It's kind of like your body's kind of like a battery with myasthenia gravis. You only get so much. And legs, for me, burns the most. It burns it very quickly. So when I walk slowly, because if I move quickly, it burns a lot more energy. And I'm just listening to my body. That's what I've learned. So when I get home from the hospital, or on the really bad flare-up days, or just at the end of the day, oops, I overexerted, what has helped me is sitting down. My bathroom, the toilet is right next to the bathroom sink. So on those days, I can sit on the toilet, and all I have to do is just lean over the sink to, spit or whatever I need to do. The other thing that I have found very helpful is those days where I need to sit, and I'm weak all over, including my arms, much more than usual because it's all over. I'll use the countertop to my advantage, and I will lean my elbows, both of my elbows, so that way my upper body muscles, like to hold my back straight, they don't have to work. So I'm slouching, and granted, most of the muscles now in my neck and my jaw to brush my teeth. I'm more or less just navigating the electric toothbrush that I use. Cannot recommend electric toothbrush enough. Any brand, it does not matter, because anything is better than nothing. But you can use that countertop leverage to, really do what you need to do. Spit right into the sink, and I have just saved a little bit of energy. Now I might even have enough energy or strength to do my water flosser and then my mouthwash, hopefully. Those are things that have helped me. What other people have put on forums that I saw when I was going through things and trying to figure out what was going to work so I could brush my teeth thoroughly and do a really good job is some folks leave all of their supplies, all of them, for brushing teeth on the bathroom counter. If only my bathroom were that big. But other people have a lot of stuff, and we all need to live in that bathroom. So, but they did that, and they have everything lined up in terms of, their electric toothbrush, their water flosser, their gum supplies, things of that nature, the mouthwash, things of that nature. If you do that route, just make sure you find a way to cover them, because it is a bathroom, just to keep everything clean, and you don't want any unwanted bacteria from the bathroom on your tooth care products. So that's it. Oh, look at me. All right. Finishing shorter than I thought. But those are the tips and tricks that I found. I hope this helps you. And if it does not, there are Facebook forums or groups that you can join that might have tips and tricks that might help you with your specific challenges with brushing teeth and gum care. And if this doesn't help you, I hope you find a resource that does. But take care. Have a great day.